You got it.
Good evening, everybody.
Evening.
It's good to be here again this Monday evening to discuss about our usual discussion on COVID and to give update about what is going on in our city regarding the COVID um, pandemic that we've been dealing with for so long. So I'm going to start the update, and I want today to be a little bit interactive in the sense that I want us to all to discuss what we're feeling regarding this COVID pandemic. So I'm going to start by giving the update, and I know in-depth updates. I have Dr. Crony here that can help me towards the end to give whatever updates that I'm not able. Maybe I forget us or stuff. So she'll be able to give us more update into what is really going on. But the first update is that we have now Sherry. Can I get the?
You don't see the slide?
No, I see it now. Yeah, we now we have they gave us information about what has been going on in US over the past 24 hours. And if you look at the information in the slide, you'll see that we have over 102,506 cases in the US in the past 24 hours, and we have 430 dead. So this thing is still going on. And if you see the average for 7 days average daily case is about 87,000. So the pandemic has been gradually rising in the country, and we now have a new variant of is like a sub lineage of the Omicron that has been going on in South Africa. The sublineage has been going on in South Africa and Australia. That is the one they call the BA4 and BA5. So, and it's been in our country, but it's not that predominant like the other sublineage that I'm going to discuss during the slide. Can you give me the second slide, please? So regarding our city, New York City, our alert level is still medium. I mean, that means we're orange. We're not the very high level is the red one. And I think the brown one is the high level, but we're still in medium, but the cases are rising. We have about the cases in New York City per 1,000 is about 303. Hospitalization is increasing gradually, 9.2, and the hospital bed occupancy is increased to 3.8%. So gradually, this thing is still rising up gradually in our city. So can you give me the next slide, please? So this, can you make this a little larger, because I really want people to see this. Well, while you're trying to do that, I will just say you see the from the Omicron. Once you see the origin, this is showing you how these things start breaking into different variants. So the Omicron broke into BA1 and BA2, and we have a sublineage of BA2 becomes BA4 and 5, and the BA2.12. The 4 and 5 is rising in South Africa, like I said earlier, in Australia, and the transmissibility is higher than the previous BA1 or 2 and the Omicron. So people get infected quickly with this. And but the one that we're seeing more on the rise in New York City is actually, can you go back? The
Give
one
me
we're seeing, no, the previous one.
give me a minute. I'm coming because something is blocking the screen.
So the one we're seeing more on the rise in New York City is actually the BA2 subset 1.2. And that one is the transmissibility is about 25% more transmissible. So, I mean, this is what you can see. That is where we started from the origin, and we're getting a little different variants coming out of the original COVID that we had. And now, because of all the people that has been our community healthcare workers that has been out there, next slide, please. They've been telling us a lot of reasons that some people are getting tired. If you look, the first thing says consumers and news outlets express their frustration and lack of trust in CDC because, this thing keeps changing and we get one today and then we think everything is almost over. Then another subset, we get another variant of the same COVID and people are getting tired. And number two says consumer express pandemic fatigue and stated they would no longer practice prevention and mitigation strategies. People are tired. I mean, I've heard a lot of people say, oh, they're tired of the mask. Can't we go reduce that a little bit and stuff like that? And people are honestly tired about the COVID. They want this thing to be over, but it's not over yet. So that's why we're doing this to give in the information about what is going on. Because when the COVID first started, we didn't know what was going on. We didn't understand it. But now we understand it, but we were getting fatigued. People are getting tired. So today I want us to engage and talk about how we feel about what is going on and what do you think we can continue to do to protect our own family, our friends, from getting this virus, because in the hospital, the numbers are rising, like I said earlier. I mean, in my own hospital that I work, we have 18 cases in there today. So it's rising, but most of the time, I want people to understand that it's rising among people who refuse to get their vaccine. And so people are tired of getting the booster. Even those people who already got their booster, they said they're tired. They don't want to get any other thing in their in their body. So I just want us to discuss and share your own feeling regarding all that is being said, so that we know how to help our friends and family. And if we know what you are dealing with, it will help us, even our community workers, to know how to talk to our people, our community members, in the sense that if we feel it, they feel it. And what is the best way to really try to help our people to get vaccinated and to help them prevent whatever is going on? Because even we ourselves, I think we have the fatigue too that they're talking about. Sometimes even you get tired of saying the same thing all the time. We get fatigued. We get tired of Zoom sometimes too. So I want us to just talk together, so that, because the way that we can help serve our community is to for them to understand that we're going through the same thing and what can we do to help them. So I want us to open it out and let people just discuss about what they have, what they feel about what is going on, and what they plan to do, to make sure that this virus does not affect their family members. So I'm going to leave the floor open to anybody who wants to say something. And if, you know.
Okay. You can digitally raise your hand if you have any comments, any feedback, any thoughts you want to share. Feel free. Just to add to what Dr. Sunday has said, the numbers are rising. and the numbers are rising, and it's really important for us not to be fatigued. I was talking to Dr. Coney on Sunday last week, like, yeah, I am getting fatigued. I'm fatigued of writing report, fatigue of thinking of strategy of how to intervene. And that is a reality because we've been at this thing for more than 2 years. Even before we officially started with the grant, we were working in the community. So we've been working with this pandemic for over 2 years. So it's understandable that we're tired. So if we're tired, we know our community is tired too. We know people are tired of the mask. And I see it when I go on the train, I take the train to work, the railroad mainly. I see people are sometimes not wearing their masks as they used to. But part of the mandate that actually came out today, we got email from the Department of Health from my job. I know it happened also at the meeting that Dr. Konya and Dr. Sunday went to. They were, the email we got was now mask is mandate for the staff of Department of Health when you are in closed building. Before it was optional, for staff to wear their masks, but now they're making mandate because we moving from low alert level to medium, and the medium is actually higher, going close to high than just the medium. So those are the thoughts. Sister Rosie, you have your hand raised.
I just wanted to say that my husband and I, we look kind of strange because we wear the mask all the time. You know, we wear the N95, and every place we go, people look at us like, "Whoa, look at these people!" But when we just wear it, and no matter what, if everybody's not wearing it, it doesn't matter. And the other thing is, I write emails to my family, and I tell them, listen, I'm serious about this. I don't want to die. I'm giving them a warning, I'm giving them a warning. I don't want to die, And to tell you about being tied with the mask, I let that one go. I want to tell you, very interesting what happened. This was beautiful, beautiful sight that I saw. I went to Dollar Tree. Dollar Tree, you really have to wear the mask. So I went to Dollar Tree, and on the way out, a lady had the KN95 like this. She said, "I ain't playing." I said, "Great." And she said it. She summed it up. "I'm not playing." I said, beautiful. But I just want to say, I also carry around, because you guys are so generous, I carry around masks with me. And you know what? I very gently go up to people, like the person in like Dollar Tree in the front, no mask on, and I tell, "Oh, here, sweetheart, would you like this? Look, it's free. I want you to stay alive." I go around doing that. And even the homeless people on the street, they're so appreciative. I said, "Sweetheart, listen, I want you to be able to go in stores and wherever." And I give them the mask, and they really thank me. They thank me. So I like that lady said, I ain't playing. I ain't playing. And about, I have a friend, she's totally, she doesn't go any place. She's very Christian, like she's Pentecostal, Indian Pentecostal. And I had argued with her once. I said, I'll never do that again. I'll never do that again because it's not going to work. They're very adamant and they're not going to wear it. The only thing that's going to work is prayer. The only thing that's going to work is prayer. And I get laughed at too. I was telling you the last time, I get laughed at when I'm out in the street walking. I don't care. I wear my mask, and we wear it all the time.
So
I could be an example, just to be an example. What we can do is be an example ourselves. If we're talking about it and then we halfway do mask, no mask, halfway. No, I do it all the time. My husband does it all the time. We don't play.
Yeah, so I mean, it's so great that you have just made up your mind to do that. And I'll tell you a little bit of my own experience, because I remember the first wave. We had all our PPE, everything. There's nothing showing, gloves, everything. We put it on, and we went through those stages. Even so nowadays, I find that some people come to my office, and they might have their mask on. I take my mask off. Sometimes I'm in the unit. I feel like I'm not just doing like you're doing. I feel like I've relaxed a little bit. I think it's the same fatigue that everybody's talking about that they're going through. Sometimes I just get a little bit of anger. I'll be like, I'm tired of this thing. I just take it off. And sometimes I just have to talk to myself. And if we that is trying to get the community, we're feeling this way, we must first identify with that feelings. Because sometimes I just don't, I'm tired of it. You understand? I mean, sometimes I'm in church too. I have the mask on. I just want to get the mask off. So the people in our community is feeling the same way. How do we help them? You understand? To stay focused, because you have resolved that. Yeah, I'm going to put on this thing, but some people are dealing with that. How can we best help our community that the virus, the infection is on the rise? And the government is even looking to mandate some of those things that they've relaxed on. And the people are going to have, immediately you tell people don't do this, that means I should do it. That's the way people feel. So how do we now, we just want to use this, and I know some people are in the community talking with the people and everything. How do we strategize to make sure that, despite the fact that we're getting frustrated with this thing not living, it's not, people are not, if this thing keeps changing, you can't blame CDC for it, because if they say, oh, this thing is this level tomorrow, they can say it changes tomorrow, they will change. We want something that is constant. We don't want changes, but this thing keeps changing. So how do we best help our community? That's the question.
Donna, you have your hand raised. Unmute yourself. Unmute yourself, Donna.
Okay. Good evening, everyone.
Good evening.
Yes, I know that the vaccination, first of all, I do agree with that everyone should get vaccinated. And vaccine is not new. It's been it's from back in the day, many years ago. Even when I was a child, we had to go get vaccination, right? And thank God we're still here and healthy. In addition to the vaccination, it's just a matter of we have to really continue to educate the people, because of the value of being vaccinated and after vaccination, and also wearing the mask, especially where there's a lot of people, a lot of crowded areas, and some people. And the next thing, they must educate they have to remind the people that hand washing is another thing, because our hands carry a lot of germs. So we should always be aware that we should be washing our hands, not those that just work in healthcare, but all of us. In addition to that, we should watch what we eat. We have to make sure that we have we know we can't eat a perfect meal all the time, but they're like fruits with vitamin C and stuff like that, orange, grapefruit, that type of thing. And supplements, the vitamin D3, that is very helpful. Because ever since the pandemic started, I wasn't taking D3 before. And I have to say, since I've been taking all these things, I have not even had a cold since the pandemic, thank God. And of course, education and watch what we eat, try to eat a balanced meal for the most part. And, we know we eat some junk food sometime, but we must include healthy foods in our diet, and continue the education, and hopefully the people will catch on board, I teach a class every other week, and they were telling us at first not to wear, they don't have to wear the mask. But what I did, I decided to tell them, I'm recommending that we wear the mask, and everybody say, okay. Because they said not to ask them if they're vaccinated and all these other stuff, because they had changed things. But when I go in, I just try to, kind of speak nice to them and tell them, listen, it's I know that we don't have to, but I'm wearing it, and I'm recommending that we all should wear it just for all safety and stuff like that. And then so far, everybody's like, okay, we're wearing it, because when they get a break in between and after eating stuff, of course, we're going to take off the mask. But especially when we're around a lot of crowd, we need to, because we don't know who's vaccinated, and sometimes people cough, they don't cover their mouth, and so forth. Okay, so that's all I have to say.
Well, thank you, Donna.
Thank you so much. Thank
Sabrina?
you. Yes.
Sabrina?
Yes. Hello, everyone.
Hi, unmute yourself.
I did. Good evening, everyone. We just went away to Vegas. Just a short. We've seen more people without them, honestly. Okay. And I think they need to come back. We need more support on this because they done got happy-go-lucky. We don't need the mask ever since they uplifted. Okay. So we need more support to say that the virus is out, is still out, is growing and is taking its time, but it could go so fast on us that that's something that we don't want. So by us still giving out, it's working, but you can still see that they're free, the fact they don't have to wear it. Okay. So that's when it comes down to Department of Health, the senators, and all. We need more support. Okay. When we at the train station, I noticed today coming back, they're happy. They don't want to wear the mask. We try to explain to them that, it's still a variance out. Please put it on while you're going on a train because so many people. You have some that listen and some like looking at us like, please. Okay. So I see that we need more support from more of the up higher people that can put a restriction or say, you have to have this mask when you go out shopping to these big shopping areas. You have to have masks when you go into church because some churches are big. You have to have masks when you're going to movie theaters and stuff like that. If we could get at least all of that, it could kind of help us because it's not like they're free all over to have a mask. So that's when I went away and seen that, I was like, wow, so many people was not wearing a mask. Also, the hotel I was in carries 2,200 rooms. Okay. And it was so many people without that mask. Wow. Okay. So as our 16 group, we knew to have our masks. The flight, you had those that had the mask, but then they got comfortable. Like I said, I feel they're comfortable. And once they uplift that, it was like no one else can tell us what to do. We can still give it out because that's our job. We can still give them advice. We can still give them the palm card, but we need more support because once they uplift that was it. And now that I went to another place and seen it, so could you imagine all over the world now? That was just one place, Vegas. So could you imagine all the rest of them? So I feel we do need more support. We are all doing our jobs, but once they uplift that, that's where we are stuck at. And pretty much that's all I can say right now.
So as it is right now, I think the CDC and Department of Health is recommending that everybody should go back to putting on masks. But I think the mandate is going to come very soon because the number is rising. So the government will say that. But one thing we all know is that we have protecting ourselves is in our hands. Because, at the beginning, even our government didn't even believe, they believed that this thing is just going to come before the next 3 months, everything will whistle away, everything will fade away and stuff like that. And it didn't happen like that. So sometimes, like when I feel like that, I just have to always remind myself that I have an aged mother that I have to go see, and I have my children at home that I have to protect. I have a lot of people that is counting on me. So all those things help me to keep focus to all those things, because everything that our community members are feeling, I think I'm feeling the same thing too. But I know that it's my responsibility to be my brother's keeper. And because of that, I am going to do it. Because I have seen the effect of COVID in so many ways that, I'm a little satisfied with the plan of care that we have now. because I know that I'm boosted. I have everything. I'm usually the first in line. Once I can get the boost, I go get it. So, but I'm tired. But once we keep, because you will meet with people that will say, "I'm tired of it. I don't want to get it." So, what are the other ways of we talking with them is to tell them that, listen, you got to do this, for that. You already got your booster. You already got this. It might not really do much to you, but just do this for your community's sake and stuff like that. We might be able to get some people to do the right thing if we say that. So I'm going to tell Miss Mother Ingrid to unmute herself to say what she wants to say. Then after her,
can I say one thing, Doctor? I do see that they want the COVID home kit tests very much. That's something did not die down.
Yeah, so
they want those a lot.
Yeah, we will continue to distribute that, and as a matter of fact, they've also given more masks, and we're going to get that across to the community because we have requested for more N95 and the surgical masks, and we need to give that to our community. We need to encourage them to continue to use it. But when we come in contact with them, when they talk to us about how tired they are about doing this thing, these people they've been going through this thing for 2 years. People are bound to be tired at this point. So how do we continue to encourage them? Is to continue to tell them that it's the right thing to help our community to do. So if Mother Ingrid is there, I will want her to unmute herself.
Yeah, good night.
Good night.
What I have to say is this: I am not working anymore. And for me, I do not go out much because not the mask. I'm okay with the mask. But even if I have to go downstairs, you have to change your clothes. You have to put on your mask. It's such a routine, to go down. So most of the time I stay upstairs. But when I have to go out, I was on the bus the other day, just the bus from here by my Mott Avenue. And the bus was crowded. And the bus said mask. And there was a lady standing behind me without a mask on her phone. And she's crackling. I had to walk away and go right up to the front of the bus. It's just that the people not obeying the law. And when you don't obey the law, then there are consequences. You understand? Then 2 Sundays ago, I forgot my Bible in the building. And I was in church. I sat down, then I said, I wouldn't enjoy the service because I'm thinking about the Bible because you can't leave anything there. So I decided to come home on the bus. The bus was crowded, who coughing, who don't have on mask, and they have to sit down next to people, no distance. You understand? So this is some of the causes that, the things that causing this thing to spread like that, because there's no respect for the law and the rule, and most of all, no respect for themselves. Because when you do these things, you're not thinking about, you're not thinking about yourself because you don't care about other people, so you don't care about yourself. But the mask, I don't mind, I'm wearing it. I don't care, I'm wearing it. I have from the son brings for me and I got from you all. And anywhere I have to go, if anybody come into my place, even the mailman to the door, I put on my mask. You understand?
That's nice.
And if people will follow the rule, whether you have the vaccinated or what or not, follow the law. And this is the problem. That's what I have to say.
Thank you. Thank you, Mother Ingrid. I'll yield the floor to Ms. Page. Please unmute yourself.
Hi, good evening, everyone.
Good evening.
I agree with what has been said about the need to continually to educate. I think that is very important at this time, especially regarding the increase in cases, just to re-emphasize that and continually bring it to light to people because there is a comfort level with I think when the cases were low, and I, as a teacher, once the school opened up the possibility of not wearing masks, a lot of students and teachers stopped wearing the mask. I myself stopped wearing my mask in the school because it's very difficult to talk and to talk pretty much all day and have the mask on. So I stopped wearing my mask in school, and I felt comfortable with it because I was boosted. And so it wasn't for maybe a month later when I was doing an after-school assignment that involved teachers sitting in a room, and I realized that the ventilation wasn't good, and a lot of teachers did not wear masks, that there was an increase in COVID cases, and I contracted also COVID. So I thank God that I just had a mild case, but I think there's just a need for more awareness about the increase and the effect that you can contract COVID because the increase is we're at levels that are much higher than what they have been in the past, and then also education in terms of the frequency of the boosters. How often should people have a booster shot? So I think you're doing a good job in the community, and I would just say continue to emphasize what you see in the hospitals and what you see in terms of the increase in the level.
Okay. Thank you so much. If I may ask you a question, are you vaccinated?
Yes.
Okay. So I
yes,
think
I'm vaccinated.
Okay.
And that's probably why my case was more mild.
I think that's the reason why you have a mild case. So
actually, personally, sorry to interrupt, I personally gave her a first vaccine. The first,
yes.
I gave it to us. I can attest to it.
So, and that is what we're seeing now, is that those people who got their vaccine, when they come, they're not even hospitalized. They don't even have to stay in the hospital, because it's a very, very mild case. So the vaccine too do work. So I'm really happy about that. So the one of the most important thing is that we must give whoever we come across the evidence-based what is going on. That is what will help us to really talk to them and to really encourage them to take those things and give them the rationale why they should get all those things. You see, we've gained a lot from what is being said today. They've told us we need to boost our immune system, in the sense that using our D3, vitamin D3, and all those things to boost our immune system, vitamin C, and make sure we do everything in our power to make sure we protect ourselves. Because the infection is on the rise, we must make sure that we continue to use our mask, we wash our hands. You know, it's very, very important. I can tell you one thing that they did in Kings County when I used to work in Kings County. They will just approach you, you won't even know, unknown. They will just come to you and ask to take a sample of your hands. And once they take the sample of your hands, they take it and they go and grow it out, and they take a picture of it and use it as a screensaver. And most of us start saying that we got to wash our hands all the time, because you don't know when they approach you. And once they approach you, the infection control, you have to give it to them. So are you raising up your hands, Walter? Are you? If you are,
yes, sir,
unmute yourself. Yes, unmute yourself. Yeah, go ahead.
Just a couple of things I'd like to touch on. First, to Sabrina, my partner, I just want to remind you, Sabrina, that unfortunately, COVID-19 has become politicized. So depending on the state that you go to, you will see different levels of cooperation. In a red state like Nevada, you won't see as many people wearing masks as you would in a blue state. That's the first thing I want to say.
Okay.
The The other thing that I want to say is that, Dr. Crony, you have allocated us 25 test kits per day. Because these are only single tests, we are asking that you, at the very least, double the amount of kits that we can take each day.
Yes,
We're
certainly. We placed, I think, Simi, if she's on, she picked up test kits today. I don't know what variety they are. And we've placed another order today for test kits. Now, this is the thing. Remember that the funding is not there anymore. Okay, so the city is running out whatever they have is what they're releasing to us. So, you know, you're right. This has been politicized in many ways, including the funding stream and including the medico-political opinion rather than following the data and following the facts. You know, the politicians have taken to this. I totally agree with Dr. Sunday. The messaging is completely confusing, because one day they're saying, okay, don't wear a mask. And then, you know, the next day they're saying wear your mask. Now, this is confusing because they're not leaving it in the hands of the medical teams that and the public health teams that have the data. We noticed a trend last year that this virus does not follow the trend of other viruses. So if you recall, in the summer of last year is when Delta arose, in the summer when virus should not be prevalent. And here we are in May, in middle of May, going into June, okay, with an increase in case numbers and rising numbers. They anticipate that by next week or week after, we will be in the high alert level. Right now, we're in the medium. Okay, so this does not follow the former knowledge that we have about viruses, where they disappear in the summer in the warm weather, and then reappear in the colder weather. So, you know, with that, I think that is information that really needs to be pushed out there, that this is not a normal virus. This does not behave like the flu virus. Okay, so we can't use the same protective measures as we would for the flu virus. This is turning out to be a year-round virus with surges and with low points and surge again. So we just came out of a low point, and now we're headed towards a surge again. And you know, we'll probably head back down to a low point, and then in the fall, come back up to a high point. So I think this needs to be explained better to the public so that we can understand what we need to do to protect ourselves by wearing the mask. The point about vaccination, this reveals the inequities, not only in our community and not only across the United States, but across the world, because certain countries don't have access to vaccines. So those viruses, the virus, the Omicron, the Delta, you know, the COVID variants are doing what they do best, which is replicate and mutate. And the world is not a large place anymore. You can travel from, you know, Australia, where they're having a big surge, a big increase in cases, right? and be in the United States in under 24 hours and bring that virus with you, okay, and then pass it along. So, so in order, it really has to be a global effort in terms of vaccination. And right now, all of the inequities are being uncovered. Okay, inequities in vaccination opportunities across the world. And I think that is a contributing factor to why we can't seem to get out from under. If everyone across the whole world had access to a vaccination, okay, and it takes work, but I think that with the information and with the knowledge and the people power, and if we could get into the far reaches of the world, I think we might be able to yield a difference. It may not be overnight, like we're hoping, for something overnight. That's not going to be the case. It wasn't overnight for smallpox, but the era that smallpox was in was different. Travel wasn't so widely available, okay? And eventually the vaccine was able to get to all ends of the earth and, eventually eradicate smallpox. But it didn't happen in a year or two. It took decades, but it was different then. But now we are living in a world that is very small, but also has great inequities. And so, that's where we are. That's where we are.
Thank you, Dr. Crony. And we one thing we know with this COVID is that even though it's politicized, is that you cannot wait for the government to dictate what you do for you. It's your responsibility to take care of yourself and to take care of your family. At the beginning of the COVID, the government was saying whatever they were saying. They didn't even understand what was going on. So it's our own responsibility to make sure we protect our community, and then we encourage each other to make sure we do the right thing to protect each other. Because if you listen to a governor that is an accountant before he became a governor, a lawyer, he doesn't know nothing about infection. It's whatever they tell him, and it's whatever his political stand is what he's going to talk about. So there's some places I won't even go to because I don't agree with whatever they're doing at this moment, because I know that tendency to get the mild case is high if I go to those places, and I don't want that thing to touch my body anymore. But I think we should take responsibility for ourselves and our family and our community. I want to give the floor to Sister Grace. She raised her hands to unmute herself to say something.
No, I'm good. I'm good, Dr. Sunday.
Okay.
Okay.
Okay, Yvette, I see your hand was up.
Yeah, I was just going to let everybody know that the test kits we received today, they were one test kit in each box. So we still are down to the one in each box. So if we have a family of 4, we're going to have to give them 4 boxes instead of 2 boxes when we had the double test kits. 2 test kits in each box.
Right.
So now that we're just down to 1 test kit in each box, they're going to go a lot quicker.
Yeah. We're I didn't realize that either until the ones that we gave out yesterday were 1 test kit. So, but I ordered more today. We're going to continue to order them until we can't order them anymore, because that day is coming. Because Congress has not acted on reappropriation of funding for COVID. So we're going to give them out until we have no more to give out. The mayor has asked that we give out 1 million masks in the upcoming weeks in anticipation of this surge that's coming. So we ordered we just ordered KN95s. I didn't order the surgical mask. I ordered the KN95s. And so I ordered 10,000 of them. And so hopefully they'll approve that order and we'll get them in by next week. Okay, and I ordered the test kits. We just keep ordering that until there's no more. And Dr. Ige is hoping that, you know, something happens so that funding will continue so that more test kits will be available. You know, but we're all doing the best that we can. Yes, we are fatigued. We're tired of this. But you have to push yourself, like Dr. Sunday said, you have to push yourself internally. You have to push yourself to do this, to wear the mask, to be aware of your surroundings, and to, you know, it becomes an internal impetus that you have to rely on. You cannot rely on somebody else telling you to do it. You know, you just have to have that grit within yourself to continue to wear the mask, to do the testing, you know, to be aware of your surroundings, to do all of those things. And it's a hard point, like in anything, you come to a wall, like you can hit the wall, okay? But you can't allow that to happen, especially if anyone on here is an athlete. You know that when you're doing whatever sport you're engaged in, you can literally hit a wall where you feel like you cannot go on any further, but you know you have to go on further. Like if you're running that marathon, you can hit that wall where you say, you know what, I just can't do this anymore. But that is the battle of the mind. So you have to battle in your mind and say, no, I can do this. I can push on. I've trained for this. I've worked for this, and I can overcome this wall. I can overcome this hump. Then you get a fresh breath, a fresh wind, and you go on. And that's the point that we're at now, where everyone has to get this fresh breath, this fresh wind, and push through and push on. So, you know, just be encouraged, continue with the work that you're doing. Just continue with the messaging. And, you know, allow people their opportunity to vent and to rebel, as it may be, but don't rebel too long. Don't stay there too long, because COVID is not respecting your request to take a break. It's not giving us a break. So we just have to continue pushing through, pushing on. It's a battle for the mind now. That's where it is, a battle for the mind, to know that this is still out there, is still harming people, and we still have to take these steps. And that's the battle of the mind. That's where we are.
Yeah, thank you so much, Dr. Crony. And also, you know, I think just continue to educate our community. It's going to help us in combating this virus, in the sense that, you know, that nowadays I see a lot of people, when they have some signs and symptoms, they immediately isolate themselves from the rest of the family. And in doing so, they're protecting the rest of the family to make sure that everybody was protected. At the onset of this virus, you know, we don't have too much information. The husband and wife still sleeping together on the same bed. The children comes into the room, they share the same bathroom and everything. And before you know it, everybody has it. So we continue to educate our community and tell them to continue to do the practice and use the protective gear, wash their hands, learn when they start having some signs and symptoms to isolate themselves, you know, and try to protect the elderly among among us to make sure that they don't contract this virus. And as long as we continue to do that, and we leave our medical agents, to producing more vaccine or continue to demystify the mystery of the virus. And I think we will all be okay in the long run. This thing cannot destroy us. We know that for sure, for a fact. God has given us the wisdom to be able to combat it, and we're going to overcome it together. So we just continue, everybody that is in our sphere. And I like what Sister Rosie does. Sometimes when you see some people without mask, I mean, if you have extra, you can volunteer to give them some. It's just an opportunity to just tell them, hey, put on your mask. Because if you tell some people put on your mask, they might be, oh, you need this. So if they don't want it, they'll tell you, I don't want. But at least you offer them. They know that some people still care in the community, and all our community healthcare workers are doing a great job going out in the community and meeting people. And sometimes, you become the therapist, you become the shrink, you become everything, because they lay everything on you. I meet with a lot of family members too. They lay a lot of stuff on you, and you're going through the same thing. You're tired of the mask too, but we just have to continue to do what we have to do. And we know the mask has protected us a lot, because even the flu this year, I mean, there was nothing called flu. I didn't see it, so, and we should just continue to protect our community and make sure everything goes well with us and our stuff. We'll continue to look to get the mask and make sure we give to us. And I know that, like you're saying, the test kit is helped a lot of us. It's helped a lot of people in our community, in the sense that when they feel anyhow, everybody just go test themselves and check it, and they're okay, they're satisfied, okay, they're happy, they can go on their way. But so we need to have more of that, and we're still pushing to make sure that the government, they see the reason why this thing needs to continue in our community, because we need to give it to people. That will give them peace of mind, and then that will give them opportunity to know what is actually wrong, instead of running to the hospital and doing a lot of other stuff. And I think that will help us a lot. So I don't know if anybody has anything to say, to share, to talk about.
Okay, we have about 6 minutes left. If you have anything,
don't forget,
say.
Boost your immune system, vitamin D3, vitamin C, eat healthy, try to do everything right. This is not the time to be on junk food. Try to get your balanced meal. Those of you who know about all this balanced meal, I still don't understand it totality, but I try to eat healthy too, because I have a chef at home that she's been trying to get me on point, and I think she's doing a great job. So I'm going to hand this over to Dr. Crony and Sherry.
I thought I didn't know I was muted. I said you're gonna hand it over to your chef.
Yeah, I hand it over to the chef.
I was muted.
That gives me balanced diet.
Sister Ingrid, you have something to say? Your hand is up again.
Yeah, just agreeing with Brother Sunday and the sister. Eat right, live, and take your vitamins. You have to be a lifestyle, and I could attest to that. This is why I'm standing, and in the name of Jesus, just take your vitamins, eat your vegetables, eat your fruits, drink plenty water, drink your milk, and go ahead. That's it. Thank you.
And this too shall pass. That's good.
Yes, this too shall pass. Yes, definitely.
Shall pass. I'm gonna share a quick announcement, even as we round up. We don't like to keep you guys more than the time. So you guys have been hearing about Nia Bully. Nia Bully is a program that is supporting parents of children between the age of 0 and 7 years old. And we have two parts of the initiative. One part relates to a conversation that we have on the Zoom platform. It happens every second and fourth Tuesday. So Sister B, can you look up the next meeting for me so I can announce it? And then the second part is where we do stories come to life. And the last one we had was May 7th. That was the flyer that you see. And if you actually look at me, I have the flyer of the program. Let me see, I don't know, can I spotlight myself? Let me see if I can pin. You guys might not see it. I'm pinning myself. I don't know if you see it. We are putting the speaker view.
We see the flyer.
You see the flyer? Okay, beautiful. Thank you.
Yes, the next meeting is May 24th.
May 24th is the next meeting, and then the Zoom platform is not the same Zoom platform, it's a different one. So the Zoom ID is 848-3388-7035. So in that forum, we have a lot of conversation regarding how to support young parents, and we have seasoned parents come on the platform and share their thoughts, their ideas, things that they will have done differently. We address different topics. We address issues regarding to how to manage their time, stress relief, and things, how to support a new mother, how to support the new father. We've had very interesting conversation, and this has been facilitated by Sister Beatrice Page and Sister Natasha, and they're doing an excellent job every second and fourth Tuesday. So if you're free, please hop on and join in the conversation. And once a month in person, we have Stories Come to Life, where we collaborate with ACT Studio, and we talk about, they read a book and then sort of help to develop the cognitive skill of the student, of the kids, and also show the parents how they can interact with their kids, with their babies at home, through drama, through reading, through music. So it's really an interesting way to build a village where our community can get strength, power, and support and help, especially during the pandemic when a lot of people have been isolated and having it difficult and suffering alone. And we're just striving to create a platform where people can share what they're going through and they can be supported. So even anyone that could benefit from this, any daycare center, please reach out to me and we'll be able to support them on different levels. So we're working in the Jamaica area, South Jamaica area, 11433, 11434, and in Farrakhan area, 116919293 and 9293. So okay, that's all the announcement that I have. And of course, if you need a testing kit or any PPE, you know where to reach us. You can reach us at the church. We can give it to you while we're there. Or you can come to our office and we can give you whatever supply that you need. Okay, so make sure you have supplies at home, especially testing kit. You should always have a testing kit at home, but you never can tell when you're gonna need it. So it's very important to have more than one, at least two. Okay. Okay. Thank you. Thank you. Dr. Sunday, a round of applause. Excellent work. Thank you for facilitating today. And good night, everyone. It's 8 o'clock. Thank you for joining us. Miss Rosa, this is your first time, I think, but we want to welcome you. And all of our returning guests, we welcome you too.
Thank you. Thank you, Sherry and Dr. Sunday.
Thank you.
Thank you.
Bye.
Thank you. Good night.
Good night, everyone. Good night.
Good night.
Good night.
Good night.
Good night. Thank you.
Bye.